Thanks, Ron, and thanks to our distinguished congressional leaders, and certainly thanks to my partner in this endeavor, Paul Simon. As was said, for 20 years now, we've been providing care for medically underserved children around the country. We first found them in the New York City's welfare hotels and shelters for homeless children, and in the hollows of West Virginia, and in the Delta regions of Mississippi, and we're seeing them now in the FEMA trailer parks, in the wreckage of Katrina in the Gulf. With over the 1.2 million encounters that you've already heard, we've come to deeply understand the meaning of children to be without health care. And as a pediatrician, I would like to just tell you a couple of things that have concerned me since the beginning of our efforts and have concerned me throughout the debate at this time around SCHIP. There are many, many children in the United States who remain under-immunized, who remain vulnerable to diseases which should have been long ago eradicated. Every day in our programs in rural and urban America, we see children with underdiagnosed or undertreated asthma who cough all night, who are too exhausted and too sick to function in their school classrooms the next day, and too beat to play normally after school. We see kids who do manage to be brought into emergency rooms where an ear infection will be diagnosed and treated. They'll go home with a prescription without the money to pay for that prescription, or without a place to come back to get that ear checked. And so also every day around America, we see children who are not doing well in school because they have hearing loss, because they have a chronic ear infection that was due to acute ear infections that weren't treated correctly. The consequences of failing to provide the health care that our children need preventively and consistently in a mode that pediatricians call a medical home is a major problem in America with no parallel in any other country on this earth right now. Every country, even the poorest countries, have paid attention to, with the resources they have, the need for kids to get the ongoing care that they need. You know, there's many barriers to care that go beyond the insurance question. To me, this is just the beginning. We just have to assume that step one is getting health insurance for every child in America. Steps 2, 3, 5, 12, etc. will be making sure that the other barriers of isolation, of families living in communities without enough doctors, of families living in communities where they can't get transportation to even get to their doctor. These are the things that ultimately we'll have to cope with, but we have to start with this issue of getting health insurance. Remember that America's families do not wish here for anything all that fancy. It's not too extreme. These are working families who are just trying to make it every day. And all they want for their children is what every one of us wants for our children: the ability to get good health care for their child with a good doctor. And that's why an override of the President's deeply distressing veto of SCHIP is so vitally important. And it is demeaning to these families, and in fact to our nation, to respond to the goodwill of the majority of our elected leaders by dismissing their concerns about children's health care with disparaging or mindless slogans about socialized medicine or federalizing health care. It makes no sense, and it really undermines the weight and importance of this argument. If I do nothing else, I want to tell you, as I'm concluding my remarks here, about something that really bothered me, and maybe some of you as well, which is last June, when President Bush said any American can get health care. They just go to their local emergency rooms. Just go to the emergency room. I'd like to take the President on a tour of America's emergency rooms, which are dangerously overcrowded. They're filled to the rafters with children and adults who should be getting their basic health care in doctor's offices and good clinics. Children need to be followed carefully and closely with preventive health care and health information and education. And the second misconception that I'd like to deal with is that the SCHIP program is for the poorest of our poor children in America. That's just wrong. It was designed to deal with the children of low-wage earning, middle-class Americans who simply make too much money from Medicaid, which is the safety net program for the poorest kids, who don't make enough money to buy private insurance in the private market, and whose employers do not provide them with the health coverage they should need. And I want to tell you, if I was emperor, this bill would have been $55 billion, not $35 billion. But let's leave it at the $35 billion and at least stay where we are and get this veto overridden. I'll conclude with a quick anecdote that you may find of interest. In the year 2004, the entire Idaho contingent of the National Guard, that is 2,000 men and women that were about to be activated for deployment to Iraq and Afghanistan. Of those 2,000 men and women, 40%, 800 of them, had dental problems so severe that the military would not accept them. It took millions of dollars to rehabilitate a lot of those dental problems that directly come from neglected health care and poor nutrition when they were children. Even our military understands how important it is for America's children to be healthy. So no matter what your political persuasion, or your ideology, or your sense of right and wrong, nobody's interest, nor any view of America's future, can tolerate a failure to provide health care for our children. Go override.